Hi everyone, it's Karen Redman, the Mayor of the town of Gawler, and in this week's weekly update, it's my pleasure to have Dr. Malcolm Richards with us today, and also Jack Darzanos, who's the team leader of environmental services. And we're talking today about all things health. Council's currently going out for consultation on a new regional public health plan across the 4 councils, that is Barossa, Light, Adelaide Plains and ourselves as the town of Gawler. So welcome, gentlemen. Thank you. So firstly, welcome Malcolm. Thank you so much for coming today to talk about health. You're a GP in Gawler. Most people would know Malcolm Richards, some people may not. However, I'm really keen to hear your thoughts on some of the challenges and opportunities for health in particularly Gawler, but also the surrounding areas going forward, because we're a growing community, and yeah, there's always more that can be done.
Yeah, I think Gawler's always in an interesting situation. It's out suburban in a country, and it does have a demographic with a high health need. It's also at a time where there's a lot of community issues, and at the moment as GPs we're really pushing for COVID immunisation as well as the regular flu immunisation. On a specifically Gawler topic, we're very lucky to have a hospital at Gawler, and the obstetric and midwifery service has been under review for about 2 years at the moment, and there's a review due out soon. That's something we're really interested in. The Gawler birthing services are actually, they've got a good balance. They've got the obstetric deliveries. There's also shared care with local GPs, and they have a midwifery team. So women can have the same midwife all the way through their pregnancy. As a service, it really has been under some pressure over the time of this review, because no one knows what's happening. Contracts for those working have been short term, and there hasn't been a sense of we have an ongoing service that is supported at SA Health level. We're really keen for the outcome of this review to show that support to that service. So not only that it continues, but it strengthens. Gawler has always delivered women locally. The Barossa, unfortunately, has not an obstetric service anymore. So it's actually in an area not only of increasing demand from the increasing population of Gawler, but also because of the services around Gawler now coming into Gawler itself. So that's something that for us is a real concern, and we're really keen to see the outcome and keen to see the obstetric services in Gawler not only supported but strengthened in a way that the midwives can continue their work with obstetric cover so it's safe.
Yeah.
That obstetric service is there for those who need it, and the GPs doing shared care can also maintain their ability to help people through their pregnancy for a local delivery as well.
I think it's really important that we hear some of the broader issues that are affecting our community, because council can advocate on a whole range of issues, and one of the things this health plan allows us to do is to lead as community leaders. So I think having that broad understanding, so it's not just about what council delivers, is it, Jack? It's about our community and what our community needs as in relation to a health needs going forward. So when we don't work in isolation, so obstetrics and gynecology, and having expert obstetricians that are paid accordingly on an ongoing basis rather than short-term contracts is absolutely essential. And I think we've got 2.3% growth currently per year, and that hasn't really changed. It dipped a little bit a couple of years ago, but it's come back up again. So we're going to continue to grow. All the available land for growth is in the north, and particularly around here. So I think that, ensuring that we've got adequate health services and this health plan, I think certainly getting feedback from you as a really highly regarded GP is vitally important. I know that the local health network, our local health network, is starting their strategic plan process as well. So we'll be hopefully feeding into that. So I think that certainly we can assist in that way so that, these services like obstetrics and gynaecology, so that we have GPs that are adequately supported, not overworked and overwhelmed. Our midwifery team are outstanding, as we know. And I've got a health background, as you know, so we want to support them so that we can attract really highly skilled staff as well, which I think we can, but we all need to be singing from the same song sheet, I think.
Yeah, I think so, and I think Gawler Hospital has got a long and proud tradition of serving its community, and I think if our obstetric service stays healthy, that's an integral part of it, because that also means there's an anaesthetic service, and that gives it the potential to grow its surgical services. There's already a plan for a large expansion of its accident and emergency services. Well, you can't have a front of house without a back of house, and so the services that are there have to be maintained if we're going to get the value that should become from this large expansion of accident and emergency. Otherwise, we've got a huge door, but a very tiny room behind it.
Thank you, Malcolm. Now to you, Jack. Public health plan. So what are the key elements that we're looking for people to feed back into our public health plan?
It's a wonderful opportunity, and taking on from what you've alluded to at the beginning, it's not just about council, it's a very broad plan. It's a plan that's driven by the state public health plan through SA Health, and we think it's a wonderful way of actually devolving that through into local government, and then local government working with its stakeholders, local area health networks and a number of service providers within our region to drive everything from open space planning and health and wellbeing, mental health, housing, transport, walking trails, cycling trails, accessibility, housing. I think I mentioned housing, but it's an opportunity to get on board, make comments around what the key drivers are within our proposed plan. It's a new. We'd like to think of it as a new plan. However, it's sort of looking at what we've done since the first regional public health plan that was brought to council, and it's a great opportunity to really look at what are the targets, what are the items that we need to be looking at to look at future growth, to look at our population, look at what the issues are, and hopefully drive some meaningful outcomes.
I think it's all interconnected, because if we work in isolation, we may miss an opportunity to advocate really strongly for what our expert health providers are needing to thrive and provide a really top-notch service. And that comes in many forms. So it's really important that we hear from people such as yourself, Malcolm, so that we can feed that into our health plan, but also advocate as and when we need to, so that as we grow, we have every right to have expert care in this area. As you said, Malcolm, we're really fortunate to have a fantastic hospital. We've got to make sure that continues to thrive and provide the service that the community expects, and also advocate to state and federal government. We've been advocating for MRI licences. That fight continues. I know the local surgeon wants a gamma probe. That's another story. For his breast surgery. So there's all sorts of opportunities locally. So I think that getting involved, feeding back on this public health plan is really, really important. So Jack, how much time have we got to feed back?
The public consultation concludes on the 31st of May, so it is accessible via Council's Your Voice portal on our webpage.
On the web, yep.
You can make electronic submissions or hard copy submissions. We're quite open to either way. We're working very closely with our 4 regional councils, as well as our consultant that's come on board to assist with the process. There is also a stakeholder workshop that is going to happen, and invites have gone out to our key stakeholders across the region. That's happening later on after the consultation ends as another, and then there will be.
When's that? Member. When's the stakeholder
meeting? It'll be on the we believe it's the 26th of June.
Okay.
And that's really targeting the experts in and around our area, and we're hoping to see, the key local health network people and providers coming along to that, to really hear from them firsthand as to what the issues are. So really, we'd like to capture as much as we possibly can, because this is critical in our project to make sure that we don't miss anything, and we are working ahead and looking at opportunities.
Okay. All right. Well, thank you very much, Jack, and thank you, Dr. Richards, for coming in. So, public consultation is out now. If you've heard, or if you want to feedback on the local health network strategic plan, if you want to provide your commentary, please get in touch. You can get in touch direct with me at mayor@gawler.sa.gov.au. You can feedback on the health plan through our website, the Your Voice page, or just turn up at one of our council customer service desks here at the library, or up at the administration centre, across at Evanston Gardens, and provide your feedback, and staff will feed that through, and then we'll formulate a new plan ultimately when it comes back to council.
Absolutely.
Okay. Yes. Thanks everyone. Have a great day.